Great. Hello, everyone. Welcome to week 5 of Epidemics of Injustice. Not forget, this semester's theme is co-disruptors and co-conspirators. And I will be reading from my slides, and then I will introduce our speaker for this evening, and then we will close out. And when that is done, we will have time for Q&A, and then we will move on to the students. Will move on to the second Zoom room where we will have our discussion. So give me a moment. Let me share my screen. So we start at the beginning. So no, that is not the beginning. So welcome. So as I said, please introduce yourself. There is a check-in form that you can either scan or there's a bit.ly form you can use. During the presentation, please put questions and comments in the chat, and there will be time for questions at the end. So this is a image of how to use the Zoom participation. So the mute, how to start your video, how to open the chat to leave comments. This is also available on the PowerPoints that are on the Google site and on Blackboard, so for students and community members to see, and it is in other recordings as well. The course instructors and teaching assistants, so Katie, Nandini, and myself, are the TAs and teacher respectively. About the course. So this annual course is free and open to the public, and it prepares public health leaders and community members with the tools to bring about social change and address structural determinants of health. All course readings take place virtually. This course is open to students in the public from 5:30 to 6:30 CST. Students taking the course for credit, they stay on from 6:30 to 7:30 for a closed discussion. Epidemics of Injustice is sponsored by the Collaboratory for Health Justice at the USC School of Public Health. And we would also like to thank the Radical Public Health for the creation, support, and promotion of this program. RPH is celebrating its 11th year. For more information about RPH, please visit their Facebook page at facebook.com/radicalpublichealth. So content warning, today's lecture materials might be difficult to discuss, so please step away if you need to take care of yourself during this presentation. All right. So I'd like to do our weekly land acknowledgement, right? So the Collaboratory for Health Justice acknowledges that the University of Illinois Chicago resides on the traditional territories of the three Fire peoples, the Ojibwe, the Ottawa, and the Potawatomi. Purchased after 2.5 years of open warfare, decades of violent encroachment, and the defeat of a pan-Indian movement to keep settlers out of the Great Lakes region at the Treaty of Chicago in 1821, receiving their final payment before moving westward in 1835. This area is also a site of trade, gathering, and healing for more than a dozen other Native tribes. The state of Illinois is currently home to more than 75,000 tribal members, and the Chicagoland area is currently home to one of the largest and most diverse urban Native communities in the U.S. Illinois is also the territory of the Ho-Chunk, Miami, Anoka, Menominee, Sac, Fox, and their descendants. By making a land acknowledgement, we recognize that Indigenous peoples are the traditional stewards of the land that we now occupy, living here long before Chicago was a city and still thriving here today. As we work, live, and play on these territories, we must ask what we can do to right the historic wrongs of colonialization and state violence and support Indigenous communities' struggles for self-determination and sovereignty. So please remember the community guidelines. We're going over them, so show up on time, come prepared. Please let everyone participate as we're all able to. Listen with an open mind. Please make sure you have mutual respect and appreciation for one another. And please respect the privacy and personal information shared during class. So this week we have conversations around abortion access and the pink tax by Dr. Julie Maslowsky. So Dr. Maslowsky, PhD, is an associate professor of community health sciences. Dr. Maslowsky is a developmental psychologist and population health scientist who studies the development of adolescent health and health behaviors with a focus on sexual and reproductive health, contraception, and abortion. She applies her findings to develop interventions to promote health and reduce health disparities in adolescents and beyond. She centers reproductive justice in her approach to sexual and reproductive health promotion. Her work includes projects in the United States, Ecuador, and Mexico. Dr. Maslowsky's Research has been funded by the Eunice Kennedy Shriver National Institute of Child Health and Human Development, National Institute on Drug Abuse, National Institute of Mental Health, Robert Wood Johnson Foundation, William T. Grant Foundation, and Society for Family Planning. She is a former member of the Executive Board of the Interdisciplinary Association for Population Science, co-director of the Special Interest Group on Adolescent Sexual and Reproductive Health at the Society for Family Planning, and a leader of Youth Reproduction Equity, a national collaborative of researchers, physicians, advocates, and youth. So we stop this share, and please welcome Dr. Maslowsky. I will now turn off my mic and camera, and we will focus on you. Thank you so much.
Thank you, Washika. Thank you, Radical Public Health. Thank you, Epidemics of Injustice, for inviting me. I'm just so honored to be here today and really excited to share with you some work that I've been doing around youth bodily autonomy post-Dobbs. So let me share. All right, so hopefully we're seeing slides. Okay. So the title of my talk today is Reproductive Justice, Bodily Autonomy in Young People Post-Dobbs. I wanted to open with some recent headlines from just news headlines. So this one, Florida court rules 16-year-old is not sufficiently mature for abortion. This was a case of a 16-year-old who was pregnant and had to go before a judge to ask for permission to obtain an abortion because her parents were not available to give consent. The judge decided she was not mature enough to make that decision and that she would not be granted that abortion. Texas family planning clinics require parental consent for birth control following court ruling. This is a very recent court ruling regarding the Title X program, which is a longstanding federal program that was written in statute to be a source of free confidential contraceptive care to anyone in the United States, regardless of age, income, or immigration status. And this judge has ruled that parental consent is now required within Title X, even though that's not the way it was written. This is an upcoming potential ruling that many of you may have seen in the news. So this is that same judge is now hearing a case about one of the pills that is used in medication abortion. And the case alleges that that pill should not be approved for use for medication abortion. And so it may, this judge may overturn the FDA's approval of that, although the legal basis for such claims is not clear. I did put an asterisk here that this refers to only one of two abortion medications because there are lots of headlines out there that are sort of implying this applies to all medication abortion regimens, and it does not. I am not a physician, but I gave you a really good link there about the differences in the types of regimens and which ones are affected. And a couple more motivating headlines, and then we'll get into it. Florida may force high school athletes to disclose their menstrual history. This is also a very recent headline, and this is asking athletes to, on a physical health form that is turned into the state, indicate when their last menstrual period was and all sorts of other menstrual history. And this is an attack both on transgender adolescents and their ability to engage with athletics, but also just an invasion, I think, of privacy and bodily autonomy. Utah is the first state to pass a gender-affirming care ban in 2023, and this affects adolescents who are seeking gender-affirming care because they identify with another gender and would like hormonal therapy in order to be treated for that. Why am I showing you all of those headlines? The theme here is a threat to the bodily autonomy of young people. I want to talk a bit about what I'm seeing, some of the action that I and my colleagues have engaged in around this, some historical sort of precedents for this, and what is coming forward, both in terms of additional potential challenges, but also what I see as reasons for hope and people who are fighting back and ways that we are pushing back against these threats to bodily autonomy. So what I'll do today, I always acknowledge my positionality. So I will do that. I will talk about reproductive justice as a framework. I will talk about the Dobbs Supreme Court case briefly, why the Dobbs decision on abortion disproportionately impacts young people, and then examples of how my colleagues and I, and also organizations around the country are fighting back. And I'll leave plenty of time for questions and answers. I am a white, heterosexual, cisgender woman. I'm a mother. I enjoy high socioeconomic status. I'm a former resident of a conservative southern state, Texas, which informs a lot of my views and experiences with reproductive health and the denial of such care. I have not experienced pregnancy or abortion, and I recognize the limitations of my lived experience in addressing some of these issues, but also hope that I can bring my voice to these important issues. All right. Reproductive justice is a framework that was defined by the Sister Song Women of Color Reproductive Justice Collective and their colleagues, their Black women feminist colleagues. The definition that they use is that reproductive justice is the human right to maintain personal bodily autonomy, choose when and how to have children or not, and parent in a safe and sustainable community. Reproductive justice also demands sexual autonomy and gender freedom for every human being. So this is the framework that I will use to couch my remarks, and I really do see this as a framework that should guide our approach, not just to reproductive health, but to societal health and to reducing many inequalities. And so I wanted to talk just a bit about the history of reproductive justice and honor those who originated this framework, which I think is just right on in terms of where we need to be going to defend the attacks on bodily autonomy that we are seeing. So, of course, in the United States, we have seen centuries of violating women's human and reproductive rights. In 1994, here in Chicago, the Black Women's Caucus of Illinois Pro-Choice Alliance met and shared their frustrations about the global reproductive health status of women and the Black women, the many challenges they faced, and the limitations of the privacy-based pro-choice movement that was the prevailing movement to support women's bodily autonomy at the time, when women of color really had minimal choices in order to exercise reproductive autonomy. They determined that there was a necessity to adopt a human rights framework for women of color and low-income women that addressed issues of bodily autonomy with reproductive decision-making. And they created the reproductive justice framework, which draws on tenets of human rights, social justice, and reproductive rights, and formed a grassroots-based movement for social change that is powerful and influential to this day. And I highly recommend the books that I've cited below as an introduction to the framework. One of the readings that I shared for today was this op-ed by Monica Simpson, who's the executive director of Sister Song Women of Color Reproductive Justice Collective. It's called "To Be Pro-Choice, You Must Have the Privilege of Having Choices." In it, she acknowledges and really lays out clearly the limitations, or many would say the failure, of the pro-choice approach to be broad enough to protect and put forward abortion rights and reproductive autonomy for all people. I chose just one quote, but the whole thing is just incredible and so perfectly illustrative of the approach that I think we should be taking here. But this really encapsulates it, I think. It's important to keep in mind that Roe never fully protected Black women or poor women or so many others in this country. That's because Roe ensured the right to abortion without ensuring that people could actually get an abortion. People seeking abortions in America must consider, do I have the money? How far is the nearest clinic, and can I get there? Can I take off work? Will I be safe walking into the clinic? For more privileged people, these questions are rarely a deterrent, but for many women of color and poor people, they are major obstacles. That's how white supremacy works. And so before we go to the continuum, I think what she's saying here is that there are multiple intersecting barriers to reproductive health care and to abortion in a country like the United States, where we have structural injustices built into every system and access to every service. And just saying that we need a law like Roe that gives someone the choice to get an abortion if they want to does not help them with all of the barriers that they would face along the way. And that's where this reproductive justice approach is really trying to dismantle the many interconnected factors that are serving as barriers for people seeking this care. When I think about reproductive justice or reproductive injustice, I picture a continuum. So on one end of a continuum of reproductive injustice, we have matters of coercion. And so this would include things like healthcare providers coercing women to use certain methods of contraception that they don't want to use, or refusing to remove contraceptive devices, or performing forced sterilizations and things that we know there are histories of and that unfortunately are still occurring in this country. We hear a lot about that. What I witnessed firsthand living in the state of Texas, which is unfortunately a leader in denying reproductive rights to folks, is that another way to commit reproductive injustice is to deny access to services, right? And of course, now that we have had the Dobbs ruling, we're seeing more and more that access to services is being absolutely statutorily, systematically removed. And so what we want in order to have a reproductively just approach to reproductive health services is that folks would have access to all services and they would have informed choice or ability to refuse. Unfortunately, in June 2022, of course, the Supreme Court ruled in Dobbs versus Jackson that there is no federal constitutional protection for abortion rights. This overturned the Roe versus Wade precedent and allowed states to determine abortion's legality. And as we know, a dozen or so states have outlawed abortion, many more have created restrictions. Another reading that I shared with you was this from Answer, which is a summary of the Turnaway study. The Turnaway study was done before the Dobbs ruling, but it was an attempt to understand the impact that not being able to obtain a wanted abortion has on a woman's life. And sort of by contrast, the impact of having a wanted abortion and how that impacts women's life trajectories. What they did, of course, this is not something you can ever study experimentally. They did the next best thing to try and study similar women and where the major difference between them was whether they obtained a wanted abortion or not. So turn away refers to some women were turned away because they were too far past the gestational limit to be able to have an abortion. They were otherwise comparable to the women who were able to obtain an abortion. There are hundreds of studies that have of articles that have come out of this study. What I gave you was just an overview of some of the main conclusions that they came to. And what they found is that a woman who is denied a wanted abortion is more likely to experience economic hardship and insecurity. And those are pretty substantial hardships and insecurities that they found. Things like eviction, things like food insecurity, real economic impacts. Women who were turned away from getting an abortion were more likely to stay in contact with a violent partner if they went on to have the baby, and they were also more likely to raise their child alone than with a partner. Their children were also negatively impacted. So many women who seek an abortion are already mothers, already have children, and so the development of the children that they already had were negatively impacted when the mothers were denied an abortion with their current pregnancy. And giving birth is connected to more serious health problems than having an abortion. So there were more medical complications with giving birth. So overall, what we know based on the best available evidence is that denying an abortion creates hardships and actually does harm to women who want an abortion. Now, I know in Epidemics of Injustice, you talk a lot about many isms. I know you talk about racism and many of the isms, and I wanted to introduce an ism that I think a lot about, which is adultism. So many of us are familiar with intersectionality, the framework that says we all live in an interconnected social categorization, and that we all possess identities of race, class, and gender, and that those intersect, and that many of us experience interdependent systems of discrimination and disadvantage based on our identities. So what I would add to this mix is one's status, one's age as a young or an old person. So adultism is prejudice and accompanying systematic discrimination against young people. And I would put forward that youth in this society is a marginalized identity, and that young people have other genders, they have race, class, and gender identities, and that those intersect, and that we have marginalized young people who are not being listened to and who are being systematically discriminated against in many regards, but I'll focus on reproductive health. This is from the National Youth Rights Association. It gives you an overview of all the other ways that we treat youth unequally in this society, and I highly encourage you to take a look. But I wanted to talk about some of the ways that my colleagues and I are fighting back against the infringement on youth bodily autonomy and some of the headlines that I showed you earlier in the talk. So my colleagues and I formed a collaborative called Youth Reproductive Equity. We are focused on supporting youth's sexual and reproductive health and their bodily autonomy with tenets of reproductive justice, focused on adolescent development for sexual and reproductive health and access to services. Some of what we've done, we formed prior to the Dobbs decision, we formed in November 2021, knowing that the Dobbs decision was coming and knowing that it was going to have disproportionate impacts on young people. We wanted to anticipate, we wanted systems and care providers to be ready to support young people if what we feared was going to happen and what in fact did happen, happened. So the first thing that we did is we published a document where we put together all of the barriers that adolescents face to accessing abortion in the United States. And this was before the Dobbs, many of these barriers existed before Dobbs because we don't treat young people equally and we don't give them full access to making their own decisions about their own bodies. And many of these things were amplified following the Dobbs decision. We also, this was the third reading that I shared with you, we put that into an op-ed form and published it here on STAT, and where we talked about some of those major barriers. So one thing that exists is that the majority of states require parental consent or notification before an adolescent can get an abortion. And this can be a barrier because not all adolescents have parents in the picture, are able to talk to parents, are able to obtain consent, even though they have decided that that is what's right for them. Judicial bypass is an option, and this is where you can go in front of a judge and ask a judge to give permission when parental permission is not available. But as I showed early on, judges are not always willing to grant that permission, and they may determine that you are not mature enough to make that decision for yourself and deny you that bodily autonomy. Travel, which has become much more important for access to abortion services post-Dobbs, is a real barrier for young people who may not drive, may not have a car, may not have the funds to support that. Increasingly, we're seeing more surveillance of interstate travel and threats to regulate interstate travel, particularly for minors. Some people who cannot travel are able to use telehealth services, but not all telehealth providers are willing to serve minors. And many states have rules that have laws that say telehealth is not legal for minors, even though it's legal for adults. So that's not an option either. Confidentiality, so adolescents, even if they are not required to give parental consent, their parents may be notified via health insurance, and that may be a deterrent. Adolescents, we as a society systematically deny and gatekeep information from adolescents, so they may not have the same information, access to information. Don't get me started on the state of sex education in this country and how adolescents are not being given the information that would support their decision making. And of course, cost is a huge barrier. Adolescents don't have access to cash and funds in the way that adults do. So we've continued to raise the alarm on things that are happening and how they are specifically impacting young people. This was another op-ed that we put out based on data that are being collected by the Society of Family Planning. They are trying to count how many abortions are happening, where they're happening. We did some projections and saw that in the year following Dobbs, at least 7,000 US teenagers will be forced into parenthood because they were not able to obtain a desired legal abortion. And that's a low and conservative estimate. I would say that probably we'll see disproportionate impacts. We were basing it on previous rates of adolescent abortion, but because there are more barriers, I would expect that we may even see more than that. Two of my colleagues wrote an op-ed about the recent decision to require parental consent in Title X clinics in Texas and how this is a harbinger of things to come. So I pulled one quote that I thought was really important to focus on here. And what they said is that these attacks on contraception will not stay within the borders of Texas. What this move tells us is that some conservatives appear to be committed to ending the right to contraception and stripping young people of their fundamental right to live healthy and safe lives free of reproductive oppression and control. And something that we talk about a lot at Youth Reproductive Equity is that they always come for the teens first, right? Because of this structural adultism in our country, because teens don't vote, because they don't have access to the same resources, because, right, it's easy if you are trying to mount a national attack or a national strategy that undermines access to reproductive health services. Starting with minors is a good place to start because they're already disempowered in so many ways. So we're really seeing this. I think in this op-ed, they use the phrase, the canary in the policy coal mine, something brilliant like that. We're really seeing this as a harbinger of things to come. They're starting with teens and continuing to chip away at access. So what are we doing about it? We're raising the alarm. We're also listening to young people. You know what? Young people have a lot to say, and they have a lot of thoughts about what is going on in this country. So we put out a study, and we got this in the field before the ruling. So we partnered with My Voice, which is an ongoing panel of young people at the University of Michigan. It's about 1,000 young people are in the panel at any given time, and they text them every week. So 14 to 24-year-olds receive a text every week about some current event, and then they text back and give their responses to questions about what do you know about it, what do you think about it, what are you seeing around you, and the goal is really just to elevate the voices and experiences of young people to inform policies and programs. And so we did a series of 3 waves. We put abortion questions on the panel, and we asked them in May, so right after the Supreme Court leak, where the initial version of the opinion was leaked. We put out into the field, and then about a week after the official Supreme Court decision, and then in October, a few months later. And we have now over 10,000 text messages from young people in 49 states, diverse young people representing every racial ethnic group, all levels of socioeconomic status, and importantly, both abortion hostile and abortion protective states. And what I can tell you, let's see, what do we have first? Hopefully this is readable for you. We visualized some of the quotes that we were getting, and I'll read a few select ones to you. But they are from all of the states. And what I can say is the majority of young people were not in favor of the changes that they were seeing coming from this ruling. They were not in favor of reducing access to abortion. So about 83% of our sample were not in favor. And so we asked, the first question we asked was, what do you know that is happening? 98% of our sample knew within 10 days after the Supreme Court leak. They knew exactly what was happening. So that our first point in our first paper is just young people are aware and they are knowledgeable and they know what's happening. Then we asked them, what do you think? And so the majority did not support these changes. For example, a young person from Utah said, these changes freaking suck. It can mean so many lives derailed and ended and so much pain that doesn't need to happen because one group of people who will never be affected are sticking their noses where they don't belong. Someone from South Carolina said, I think it's so stupid. Making abortions illegal won't stop people from getting abortions. They'll just get them unsafely. If you really want to stop abortions, you would improve sex education in schools, provide proper resources to young people, and so much more. And then we want to fairly present the data. So I would mention, for example, in Montana, somebody said there should actually be more restrictions on abortion rights. So there are some young people who believe that, the majority do not. We have additional information about where young people are seeking information. They talk to us about trying to be very careful about getting accurate information, vetting their information, being aware of disinformation, really very strategic in how they learn about these issues and trying to educate themselves, and using a lot of what I would call pretty grown up and mature reasoning and trying to form their opinions about these things. And really, we just need to respect that young people are citizens and are aware and are educating themselves about what's going on. A summary of what we saw, and I would say there's so much data left to be analyzed, but what we're seeing so far is that adolescents absolutely understand the complexity of decisions around abortion and the impending impacts of changing legality in the United States, and that we should respect their knowledge and their understanding. Our collaborative has also worked to provide guidance and resources. These are two viewpoints that were led by my colleagues who are clinicians, writing to a clinical audience and trying to provide guidance in providing primary care and sexual and reproductive health care in the post-Roe landscape. So one was targeted at pediatricians and one at adolescent medicine colleagues, and just making sure that they had access to vetted resources like abortionfinder.com and policy resources to look up what the actual laws were in their country. We got those out as quickly as possible to make sure that care providers were still able to serve young people. And then we're working on some of the longer term strategies as well. So we are working to help our field build and express professional consensus. So a theme is that young people are often not explicitly named in some of these statements and in our advocacy, right? And so, of course, after the Dobbs decision, many professional organizations came out with statements condemning it, but they didn't explicitly name young people. And wording matters, and explicitly naming groups matters. So we went forward and we contacted major professional organizations that are focused on young people and that serve young people, and wrote a statement that explicitly condemned this infringement on bodily autonomy for young people, and put that out widely so that it was clear that professional organizations do not endorse this and actually see this as harmful. So we, with our combined efforts between social media pushes and media engagement, we feel like we have educated millions of voters. We've provided thousands of clinicians with resources and strategies. We have Twitter, over 60,000 Twitter views where we're putting out vetted resources and the best research and data on this issue, as well as advocacy opportunities. And we've given over 800,000 adolescents voice on changes to abortion policy and access. And we are just getting started. We have much more to do, but I wanted to highlight other efforts in this area, because as I talk to folks about abortion access and changes in abortion policy, and lots of folks, right? So folks in the general public, but also funders, also, thinkers and policymakers, I hear a lot of despondency. I hear a lot of, well, the Supreme Court ruled, or, and so maybe we can't focus on abortion anymore. Maybe we need to focus on contraception, or that's a lost cause, or right. And I really, truly, as someone who is in this and reads, the horror stories as well as the reasons for hope every day, I really do think that there are still many opportunities to intervene, and that the Supreme Court ruling actually shook things up and created opportunities. Many laws do have to be rewritten because the precedent that they were reliant on no longer stands. Many practices, clinical practices and organizational practices need to be revisited, and there are opportunities to bolster those. So I wanted to just give some highlights on what I'm seeing out there. So, of course, as I said, major medical organizations are lining up to defend adolescent bodily autonomy. In addition to our statement, the American Academy of Pediatrics has come out very strong, supporting that adolescents have the right to confidential care with regards to abortion, that options counseling for the pregnant adolescent patient should always counsel them on the option to terminate a pregnancy, really strongly defending those rights. In the corporate sector, we're seeing things like Yelp and Google who are coming out against misinformation. So Yelp has begun to label crisis pregnancy centers. When you go onto Yelp, they will tell you this is not an abortion clinic. This clinic does not provide abortions, because crisis pregnancy centers are very good at looking like they are a clinic that might provide those services. Google also has changed its search parameters so that crisis pregnancy centers, which used to pay for ads so that they would come up first when you searched something like abortion near me, are not coming up in search results. So this is, corporations are taking these proactive efforts. We're all aware of the restrictive policies that are being passed, of the states that are outlawing abortion, but there are a lot of proactive policies coming into play in states and localities. And I've highlighted just a few, but of course, here in Illinois, we have the Reproductive Rights Act that recently passed. These are the types of proactive policies that are being considered and passed in states and localities around the country. And what I wanted to point you to is the National Institute of Reproductive Health does an annual report that is a list of proactive policies that have been passed on sexual and reproductive health. And I've linked it there. I highly encourage you to take a look. But states and localities are doing all sorts of things, figuring out how to protect data privacy, how to protect their healthcare providers who are providing abortions across state prosecution and all these threats that are bubbling up. Administrative policies about how they handle money and data and licensing to allow providers to practice in other states and to protect their ability to practice. And so lots and lots of ways to shore up and to codify access to care, rights to care, and ability of providers to provide care are happening actively as we speak. There are lots of regulatory efforts in place. So we have laws and we have regulations. The FDA is one source of regulations. FDA controls regulation of medications. And so one thing that is going on is that there is a push to make contraception more widely available. For example, the FDA will consider one oral hormonal contraceptive pill for over-the-counter use. And so that would allow an oral contraceptive for the first time to be sold in pharmacies and in retailers without a prescription. Recently, the FDA ruled that medication abortion pills can be dispensed at retail pharmacies. So previously, they had to be dispensed in physicians' offices. So what this ruling said is that with a physician's prescription, you can pick up your pills at the pharmacy, which actually does reduce barriers for quite a few people. And so in the regulatory sphere, and particularly the current federal administration, is looking for ways to support and buoy access to reproductive health care through regulations as well as through legal avenues. There are so many organizations that are doing amazing work, both teen-specific and on reproductive rights writ large. These are only some of them, but I wanted to highlight. If, When, How, Lawyering for Reproductive Justice does a lot of work on judicial bypass, on supporting young people who need judicial bypass. They have a judicial bypass wiki that will tell you all of the laws in every state and what you need to do and what the procedures are. So they have that component that is very youth specific. Teen Vogue, believe it or not, it is doing incredible reporting and has done a great job reporting on post-Dobbs issues. It is very, I think, forward thinking and is really highlighting the impacts on young people. Power to Decide is a longstanding organization that is focused on providing vetted resources for sexual and reproductive health. They have Bedsider, which is a great resource for contraception and choosing contraception, and Abortion Finder, which is updated like to the minute for facilities that are providing abortion. And I could go on, but great organizations that are working hard to support access to reproductive health care. And then I wanted to encourage you to check us out. So we are youthreproductiveequity.org. We're at YouthRepro on all the platforms. And please email me. I'm happy to hear from you and talk more about this. I could go all day. And with that, I think I finished in time for questions, and I can't wait to hear what you all think about this. So thank you.
Thank you so much. You see that I changed a little bit. It's very hot in this apartment. But thank you so much. I think that was such like a a great wealth of information, but also a really good kind of history to give us context for what we're seeing around the country. And depending on where people are living right now and the communities they're living in also around the world, because I know you also do other work in like Ecuador, Mexico, and looking at how those issues connect around adolescent reproductive health and justice. And I think it's really important that you're really centering youth opinions and movements, especially when you were mentioning the text messages and social media presence that you have across different platforms, because different types of teens like different types of platforms. Yeah, so I would definitely like to echo what some people are saying in the chat. That thank you for sharing with us all the resources, what's going on, what could be going on. And that really does help. A lot of people do want to get involved. A lot of people here are very invested in getting involved in a lot of different types of work. And so this is definitely a great way for us to kind of do that. So I have some questions here in our discussion thing that have been highlighted. And so I'll just ask them and then I'll mute myself so that you can answer. So what predictions do you have about the impact of the Dobbs decision on health and the path toward reproductive justice?
Well, what predictions do I have going forward? So I think we're already, unfortunately, seeing a lot of really negative impacts, right? So one thing I would say as a researcher is it's important to measure, it's important to have data on these things, it's important to document. And so I'm always looking to who is documenting and who is really being able to empirically tell us what's going on. But of course, we're hearing the stories, we're seeing it, right? The media is doing a really good job of highlighting some of the horror stories. And what I'm seeing in the data is that in states that have outlawed abortions, they have gone, they've had 100% decrease in the number of abortions that they are providing. In states like Illinois that are protecting reproductive rights, we're seeing a surge, right? So in the first 6 months after Dobbs, we saw a surge of about 30% in abortion cases that were being done. And honestly, the fact that we as a state are able to absorb that is really a tribute to the heroic people who are in the workforce, the abortion providers, the abortion funds who are doing the logistical work of helping people travel and navigate legal challenges and financial challenges. And so honestly, I think we saw an initial surge of resources, of passion, of interest, of charitable donations, but I'm worried in the long term whether we're able to sustain that level of support and that fight. And so I really want us to be thinking about more sustainable solutions. And that's things like policy, that's things like funding allocation, that's things like making sure we're training enough providers to replace our providers as they retire. And we need to think long term as well.
Yeah, I agree. And I think that a lot of movements, this movement can definitely learn from other movements about the reason to be sustainable, because unsustainable movements kind of fall to the wayside. Another one was you raised a great point about these restrictive policies being almost piloted on young groups before policies are passed that apply to all adults. I think the arguments for these policies often have to do with protecting the children or worrying that they may regret a choice. How would you argue against these moral-based arguments that prevent restrictive policies before they happen to youth, like in the examples of contraceptive access, gender-affirming care, et cetera?
Oh, I could talk all night about this one. So I'm a developmental psychologist by training. I study adolescent development, which means I study everything from brain development to social development to information processing and decision making. So on that level of what we know about adolescents and what they're capable of, we absolutely know from experimental settings, from real world settings, from observations, from interviews, from, name your methodology, that adolescents, when we give them information and support, they are able to make decisions in the same manner that adults can make them. Now, think about yourself when you're making a decision. What do you need to make a hard decision? You need information and you need support, right? So if we provide that to adolescents and we give them time and we give them support to make those decisions, then they can absolutely make decisions, anticipate consequences, weigh costs and benefits in the same way that adults do. And they know themselves. They are the ultimate expert in themselves and their own body. And so absolutely, and I see lots and lots of comments, and you're right that this is very linked to the opposition to transgender rights, right? It's all about bodies and autonomy and making your own decision about yourself and your future. And so I can tell you, as somebody who studies adolescents and their development, they are capable. And then to bring in that human rights perspective, they are humans and they deserve autonomy. And, you know, in the way that every other human deserves autonomy and respect and, you know, freedom to make decisions. And so I think we have to blend sort of both of those perspectives in making this argument. And I've learned a lot from my physician colleagues about where human rights come into making some of these decisions, when you really have to think about medical decisions and how to treat someone and consequences of things, that we absolutely have to rely on that human rights framework, which is what the reproductive justice movement also has concluded, that that's an essential piece of how we weigh this.
I also do like that one of the pieces that you did present, which is for anyone who is a community member, is in the Google Classroom site, about reproductive justice, not just, for instance, like cis white women, but taking into account people's gendered and racial and economic experience as well, and how those intersect as well. And let me go to the next question. How do we balance protecting, promoting, and advocating for the rights of youth, including bodily autonomy, with having policies in place that aim to protect them, such as like minimum ages for drinking, smoking, driving, and child labor? Interesting story. You should all be looking up child labor laws and how they're being enacted in states, because apparently there's some really interesting shifts happening. But yes, so. And then the questions will also be put in the chat as well, just letting you all know. So if you don't hear fully what I said, you could follow it there.
Yes. So how do we balance laws that protect people with giving people autonomy? So I'm not sure that young people are so different from non-young people in this way, right? So when someone is of legal age to drink, for example, we ideally would give them information about the effects of alcohol on the body. We would regulate it so that they're not able to cause harm to other people, right? We don't want you driving a car after you've drunk, right? And so I would say that the framework is that people need to be educated on the impacts of on how to properly take care of themselves, on their obligations to society and as a citizen, and that they would be supported in making decisions. And public health is the whole field of public health is about balancing restrictions versus autonomy, right? And thinking about the public good versus individual freedom. And we as a society have lots of processes in place where we figure out what to regulate and how much impingement on individual rights we are willing to tolerate in order to keep the society, you know, the broader public safe. And so I think that all of these issues deserve that consideration, and that young people should just be in that debate and part of that weighing what we should tolerate and what we should regulate.
Yeah, I completely agree. And so I love that this question was asked, because I do a lot of work around disability and access. So how does your work intersect with bodily autonomy for those with disabilities?
Absolutely. So some young people have disabilities, just like some young people are of certain races, young people are of certain socioeconomic statuses, right? So if you are a person who has disabilities, that's one of many potentially intersecting characteristics, identities that you have. And in our society, being a person who has a disability is a marginalized identity. And so if you are a young person who has a disability, then you are experiencing intersectionality and multiple sources of potential discrimination and disempowerment. And so I would say absolutely the frameworks that we use here are applicable to people with disabilities, and people who have a disability may be particularly vulnerable depending on the type of disability that they have, to coercion or to medical malpractice, or to a lot of just, we see assumptions being made about, people with disabilities maybe aren't sexually active, and so they don't need access to contraception, or just like there are stereotypes about racial groups and gender groups, there are certainly stereotypes that are not true of all folks with disabilities as well. So I think it fits right in as an identity that we need to consider.
Yeah, I think that that's amazing. And I'm glad you brought those up because I do believe that in the work I've done, I know that there are people who have experienced those types of barriers to information. So a few more questions. So how can we talk about what other countries have successfully done in relation to abortion access and apply it here? Would other solutions even work due to how polarizing the issue is in the United States?
Yeah. So as someone who does global health work, I love this question. And I'm always an advocate of there are 198 other countries in the world and they have ideas on how to do things. The US is, of course, very US centric. And I lived in Texas, which is very Texas centric within the United States, right? And very closed off to outside ideas. So I think that absolutely there are many models out there for how to regulate or how to not regulate abortion care. And I would love to see us considering some of those models. Is it possible? Yes, it's possible. Like there are many polarizing issues in this country. It's why we have a system of democracy. It's why we have elections. Like there are solutions out there, which is why I wanted to end my talk on proactive policy and organizations that are working toward this. Like there are many, many solutions out there. And is it a process? And do we need to, work on it? And do we need to be strategic? And do we all need to work together and have an integrated approach? And yes, but yes, it's possible. And yes, we should be drawing from international examples as well as within our own country.
So the second to last one is, what are the steps that need to be taken to start the cultural shift toward more accessible, equitable, and safe care for all? And what can we do as public health professionals to best support and enact the shift?
I love this. So I think that health is not a single issue question, right? And so my answer to this would be the same for any health disparity or any health inequity, which is that we need to view health holistically. We need to deal with upstream determinants of health inequalities, which include reproductive health inequalities, but every other health inequality out there. We need to deal with structural inequalities in this country. I mean, all the way up to things like gerrymandering and the way that we budget money and the way that we allocate votes, and right. So sort of at a political level, I think there's lots of work to be done in terms of building tolerance and reducing racial stereotypes and changing norms around. And so I love all of the work that's being done, all of the anti-racist work, all of the right. So I certainly there are things to be done specific to reproductive health care, which I covered in the talk, but given this intersectionality framework and the reproductive justice framework and the way that we know the structural inequalities are all intertwined, I would say really moving upstream as much as possible.
Thank you. And the last one was, do you have any suggestion on the ways we can start right now to, on our end, to support this effort? Where do we get started? Where do we get started to get involved at like the local level? Or local to where we are, because there are people who are from all over who are on this talk.
I think the first thing to do would be to figure out what is happening in your state and your locality. So really just know what laws have been passed in my state. Is my state an abortion restrictive or an abortion supportive state? There are states that are teetering, right? That are considering whether they should outlaw abortion or not. So first, just locating where your state is in that regard. If your state is teetering and you would like to advocate for keeping abortion legal, then I would contact your legislators. I would get involved with some of your local coalitions, because policymakers are really looking for their constituents' voice on this. I think that we know, it's clear. When abortion has gone to the polls and a vote has been taken on abortion, the public has voted that yes, abortion should be legal. That has happened in, I think, 5 states now, right? So legislators know public opinion and they are looking for reasons not to do this, right? Even conservative legislators are aware that this is not popular. And so I think making that clear, making the impacts on your community clear, I really do have an impact. And then there are many coalitions. So some of them I highlighted in that that slide of organizations that have templates for engaging in action, that have, right? So I would start there, but really just knowing what is going on, because the misinformation and the hiding and the cloaked and not sharing information and not the public not knowing what is happening is our number one danger. So know it, share it, educate your friends, educate everyone around you. And then we know that the popularity of this issue is such that people want reproductive rights.
Oh, wow, I was on mute. Thank you so much for all of your insight. And please everyone give a round of applause, virtual or otherwise, for Dr. Maslowsky. And yeah, we really appreciate all the research you've done and all of the work that you have done in engaging and teaching us how to engage with people, especially since some of us either don't have kids or we're not very young, or we want to get involved, but we didn't really know an in to how to get involved into this issue. So I really want to thank you. I do want to share one last slide before we go into our session. Just a moment. So if you enjoyed the session, please consider donating to USC School of Public Health Collaboratory for Health Justice Fund. So the donations can support closed captioning, which are about $200 a lecture, translation services that are $225 a lecture, ASL interpretations, which are about $104, and support honorariums and travel costs for our guests and future events for the Collaboratory for Health Justice. And there's more information on the community engagement tab. And so, one second, let me stop the share. We will now be going into our next session. So thank you, everyone. We at 6:30, please go into the next session. And to all our community members, we will see you all next week.